Hello, my fellow residents. So, today I'll be telling you out what are the future scope of pediatrics post passing out the MD examinations. After the examination results were out, many of the juniors or many of my friends who were thinking of taking up pediatrics as a branch have called me and asked, what is the scope of pediatrics in future? Should we take a branch? Should we think of taking pediatrics as a branch? Because taking up a branch is just nothing but getting married to a specific specialty, and later on you don't have an option to switch apart. Either you have to drop out or you have to complete and take up a other MD specialty or a MS specialty. But to make your life very much simpler, when I was just out of my examinations, I have made a tree out of what are the options available, and these I have made for you, my friends, who don't belong to a good doctor background or who don't have so much connections out in the outer world, how to apply on, what are the posts available, what are the career options post passing out the MD pediatrics examination. So to make your life simpler, I have just segregated out. But after passing out, you have to make it clear thought in your mind where you have to settle. If it's a metropolitan city like Delhi, Kolkata, Mumbai, Hyderabad, or Bangalore, or Chennai, then you have to know whether you want to settle it out with just an MD pediatrics, or you want to go for an SS or a fellowship. There's a NEET SS exam which happens every yearly, and there is an INICT which targets the AIMS, PGI, and JIPMER and Central Institutes that happens twice a year. So you have to make your choices very much clear. What are the sources which you can follow is a prep or a marrow subscription if you want to take. I am not promoting out this prep ladder and marrow. It is upon you. If you have studied very much good enough, you can just also revise your notes or revise your just those topics and appear for exam. I am not emphasizing that you must take out these subscriptions to pass out this exam. It's totally upon you. And so these DM specialities, I must just make you out clear that there are hardly one or two seats considering post MD pediatrics. What are the availability of the seats of like a super specialty, a DM? There are so for a DM specialty, there are very much less seats, like one or two seats of DM. Most of the seats are DRNB. So what is DRNB? Like how it is an MD or a DNB. A MD you do from a government college or a private or a dean, and a DNB you do it from a private institute where there is a no medical college. Similarly, if you're doing and super specialty from a government college or in private or a deem, it is called an DM. And if you're doing the same super specialty from a institute which has no medical college attached to it, there is a no UG batch, there is just PG batch, then that is called as a DRNB seat. So most of the seats in pediatrics for super specialty are DRNB seats, not as like our specialties like MD medicine or MD psychiatry or MS surgery. They have most of the seats as MS or DM. And what are the options available for DM? You have a DM neonatology, you have a DM critical care, you have a DM in hemato-oncology, or you have a DM in clinical hematology, you have a super specialty in cardiology, or you have a nephrology in plate. Like each subtopic has a super specialization, but it depends where you're taking up the branch, whether you're taking a DM or a DRNB. A DM has also has a bond service wherever you're taking in a government college, but a DRNB in that case doesn't have a bond service. It's just the 3 years you have to complete in that institute. And same like MD and DNB, the DM examinations are carried out within the same institute. Like you go obviously for the theory exams out, but the practicals are within the college itself. But the DRNB examination, the practicals are outside, like it can be anywhere around the India, and it's the difficulty level is like a it's much more difficult for passing it out. So you have to also check out the passing rate of DRNB. before joining, as we consider it for a DNB pediatrics examination. So for you don't want to fall out in taking up a 3 years of career choice of again taking up the residency and completing the bond service in that particular state and not paying out the penalties. Then the next option good for you is like you can go for a fellowship. These fellowship are just 1 year courses or a 2 year courses depending what specialty you choose. So for a neurology or a neurodevelopment, a neonatology, a critical care and a cardiology, these are just 1 year fellowships. But if you're going for an endocrinology or a hematology fellowship, then these are 2 years fellowship. So these fellowships, there are a lot of these are all external and these are not NMC recognized, but people do it for much more learning. They want to learn the 3 years in 1 year and they want to go out and flourish their practice and start practicing. So this is also one of the good options. What are the forums under which the fellowships are available? So there is one Indian Academy of Pediatrics, that is the IAP fellowship, that takes these exams takes place every twice a year. And there are the NNF fellowship, that is the National Neonatology Forum. These seats are on the interview basis. These also happen twice a year. These IAP fellowships, they are just course verified, and the amount of stipend which you're getting is much lesser as compared to what a DM candidate is getting. You cannot expect that amount. So these fellowships are also available in pediatric neonatology, critical care, cardiology, or endocrinology. The endocrinology fellowship is of 2 years. There is also one specific separate platform for endocrinology fellowships, and these offer fellowships only for 2 years in a field of endocrinology of children and adolescent age group. I just hope I have been very much clear what are the options of fellowships available. Yeah, and some institutional, I guess there are fellowships, but I don't know, depending on the availability, it can be there, but most fellowships are not recognized and getting yeah. And also if you're practicing in that university, so for me it is an MUHS, so even MUHS has fellowships. Even the fellowships have same thesis work, have same examination, theory, practical, as in case of a candidate who is appearing for a DM or a DRNB. So hope your minds are well settled that you have to have a thesis and theory examination and practical to qualify for the certificate course of that fellowship in the particular subspecialty. Now coming whether these fellowships, like these are the fellowships option which I have told you out. After examination you just have to think that where you have to practice, what is the area of your practice. If it's a metropolitan city, you can go for these subspecialties in a DM or a fellowship, and fellowship is much a lesser year compare as compared to the DM 3 years and the bond service. Fellowships doesn't have a bond. So depending what all your requirements as per your set, like what you want to do in future, what your scope is, considering that you may choose your field of choice. But if you want to settle in a metropolitan city, then make sure that you are having a fellowship or a DM, so you have a very much good like flourished practice. Many of the people do say that DM and like the if you're choosing a subspecialty, the patient number of cases narrow it down, but you can also practice your MD Pediatrics like a normal pediatrician. No one is going to take that out of you, but you have also a specific amount of cases. Yeah, establishing practice, getting those cases is much more difficult, be it metropolitan city or be you are settling out in a district level or a town level. And there are options, like you have to make it out yourself clear whether you want a government job or whether you want a private setup. You want to establish your own private setup, you want to have your own hospital, you want to run it out, then you may go for a private setup post your examinations and results. But post if you're thinking of a government job, like you want to qualify for a lecturer post, then you have a compulsory 1 year senior residency which you have to do. People who are passing out MD for a government hospital, they have a 1 year mandatory bond which they complete as a senior residency and without any penalties, and then they can qualify for the lecturer post. And for this during this 1 year also, you have certain NMC criteria which you have to fulfill for being eligible for the lecturer post. And also now there's a new circular that people who have served in a private hospital who are not having any medical colleges attached, and that hospital if it has a bed of 220 plus, then you are also eligible after a 2 years working in that institute for applying for the lecturer post. But these whatever circulars have come are currently not been signed, and is, I guess, is just in the coming format, like it's just been proposed. I don't know how much the authenticity of these circulars, but hoping by the time you start out your practice these circulars are out, and this may help you, these may help many of us out. And yeah, so these are the career choices what you can do post pediatrics. And I hope I have been very much helpful enough in telling you out. And if you like this video, put a thumbs up and share it with your friends and colleagues who may need it. And if you find this video very much helpful, please do subscribe to the channel. This is Dr. Hemangi Reddy. Thank you.